Our top story this hour, millions of people have fled Ukraine since the start of the Russian invasion there. The majority, an estimated 1.8 million, have found refuge in neighboring Poland. And some are dealing not only with the trauma of war, but with a crisis that can strike a family at any time, a serious health condition affecting a child. Hundreds of young patients have made the dangerous trip out of their war-torn country to Poland, where they're now fighting a different battle. Christina Ruffini has the story from Poland's border with Ukraine.
On the other side of this border, a rescue is in progress. Two critical pediatric patients, driven by civilian volunteers, overnight from Lviv to Warsaw. 13-year-old Kirill was rushed into the operating room hours after arrival. It was his 36th surgery.
How many kids do you have on this floor?
Normally, we can admit about 19 children.
Dr. Radek Jeber is the head of pediatric oncology and hematology at the Medical University in Rzeszów, about an hour from the Ukrainian border. In addition to Polish patients, they're treating 8 children evacuated from Ukraine.
Are most of them cancer patients or?
Cancer and with serious hematological diseases like severe anemia, plastic, etc.
Okay, so very serious things.
To have the best chance at recovery, doctors say it's paramount that seriously ill patients not have their treatment disrupted. But in a war zone, nothing is guaranteed. So St. Jude's Children's Research Hospital, based in Memphis, partnered with hospitals and doctors all over Europe to get the most vulnerable out. So far, 28 countries and more than 201 clinics across the world are offering support for these young patients. Yaroslava has acute leukemia. She was transported from Ukraine and on her way to Ireland when she developed a serious infection.
Were you worried she wouldn't get her treatment when you had to leave?
Yes, she says, they also had no place to go. But since arriving in Poland, Yaroslava has gotten the treatment she needs. And the family, including her 2 young siblings, has been allowed to live in her hospital room until she's ready to be moved.
These children from Ukraine might not be treated, not be cured. Without treatment outside Ukraine, and probably the big part of them would die, probably.
So you're saying if for these cancer patients to survive now, you think they probably need to be treated outside Ukraine, or they may not survive?
Yes, so we have to do everything. Every patient from Ukraine should be possibility to be treated somewhere outside.
Doctors working with these patients say about 400 children have been evacuated from Ukraine since the start of the conflict, with about 150 more expected to arrive this week.
For CBS Saturday Morning, Christina Ruffini, Rzeszów, Poland.
So incredible the work that St. Jude's does. They see about 8,600 children every year. Add these, and what they're doing to help and support the patients in Poland.
It's heartbreaking to see these kids who already are fighting the battle of their lives then have to move and not be able to get the treatment they should get.
It's crisis after crisis.
Yep.